Urogenital tract specimens can also be utilized. A lot of the time this is going to be in the form of wet preps. This can either be vaginal, urethral, or urine wet preps. Within these specimens, a lot of the times we are specifically looking for Trichomonas vaginalis, and these motile organisms can be observed under low power. Now we can also utilize direct antigen testing. A lot of the times this is going to be a little bit more specific, a little bit more useful than just plain wet preps. As far as sputum goes, a lot of the times parasites are rarely found within sputum, but there are some worms that have migratory larval stages, and some microsporidia can be seen in the lungs as well. So some organisms would include Ascaris lumbricoides, Strongyloides, Paragonomus. This is actually one of the most preferred specimens for Paragonomus eggs, just because of the life cycle of this organism. We might see some Echinococcus hooklets, Protozoa, and Microsporidia as well. Now we may utilize aspirates from various areas of the body. This can include fine needle aspirates, duodenal aspirates, some respiratory aspirates like BALs or bronchwashes, bone marrow, or even CSF. So what you're seeing here in this image is actually an image of Echinococcus granulosus. This is an example of hydatid sand that was taken from an aspiration of cyst fluid. The cyst fluid can be found in the liver or lung, and we examine this aspirate for hydatid sand, or specifically looking for these types of hooklets. Now, as far as our tissue parasites go, we might actually examine tissue biopsies as well. So, for example, Trichinella species, as you can see in this image, can be found in the muscle and will be observed under something known as a squash preparation. We can also look at impression smears or tease mounts to look at parasites, but if we're utilizing any fresh specimens, we want to make sure that we're keeping these specimens moist with saline. So blood parasites are also a common type of parasite that is analyzed within the laboratory as well. We can perform two different types of smears. The thin blood smear, which essentially is made up like a peripheral blood smear. This is where we're going to look for microfilaria, and we examine almost 300 plus fields in order to look for these parasites. Typically, the feathered edge is going to be examined for intracellular and extracellular parasites. Now we can also perform a thick smear, and that's exactly what this is going to be. Essentially, this is going to be a thick preparation of blood, and essentially this is going to be looking for microfilaria. We can look for malaria, trypanosomes, and this thick smear allows for improved detection of organisms, especially organisms that may be intracellular in nature. So we can utilize just a classic Wright stain. A lot of the times in the microbiology lab, we don't typically just use the Wright stain. We're going to utilize the Giemsa stain alongside of it to help improve detection of these parasites. We can also utilize a smear of white blood cells. This is going to be looking for organisms like Leishmania, trypanosomes, or Histoplasma species. So let's dive into how we classify various parasites based on their structures. So the first is going to be the protozoas. Now the protozoas are oftentimes extremely small and probably the most frustrating out of all of the parasites just because of their size and all of their different structures. So as far as the intestinal protozoa go, we can see amoebae like Entamoeba histolytica. We can see flagellates like Giardia, ciliates like Neoballantidium, coccidia such as Cryptosporidia, and other organisms like Microsporidia. Other various body sites can contain protozoa as well, such as the CSF. This can contain an amoeba known as Naegleria fowleri. Other areas of the body, as we mentioned with urogenital tract specimens, this can contain a flagellate known as Trichomonas vaginalis. Other protozoa can be found in the blood and tissue, such as malaria, babesia, flagellates like leishmania, and trypanosoma. Shown here is an image of Plasmodium falciparum, and you can see the intracellular ring forms. As far as the worms go, our first category is going to be the nematodes. These are going to be our roundworms. So organisms found in the intestine can include Ascaris lumbricoides, Enterobius vermicularis, also known as the pinworm, but we can also find in other areas as well. So the tissue can contain Trichinella species, the blood can contain species like Loa loa, or often termed as the African eyeworm. Now the cestodes, these are going to be often referred to as our tapeworms. Usually we're only going to find these in the intestines or the tissues, but intestinal tapeworms can include the Taenia species or Diphyllobothrium latum. As far as the tissue goes, this is where we might see Echinococcus granulosus. We looked at some of those various hooklets that can be produced by this organism in past slides. So the trematodes, these are often termed as the flukes. The flukes can be found in all areas of the body, including the intestines, like Fasciolopsis, the liver or the lungs, like Clonorchis species or Paragonymous, but they can also be found in the blood as well. So schistosoma species can often have their various eggs within the blood. So we will wrap up this lecture by talking about additional lab tests that can be utilized when talking about parasitology. So if we're looking at direct detection of these parasites, there are various tests for intestinal parasites that can include fluorescence, like your DFA. We can utilize enzyme immunoassays or immunofluorescent antibodies. With blood parasites, we can utilize antigen capture, immunochromogenic systems, or we can utilize PCR. Now, serology typically is recommended when collection of a direct specimen might cause a risk to the patient. For example, if we are looking at hydatid sand in various tissue cysts from Echinococcus, this can be very detrimental to the patient as these cysts can rupture and the hooklets can embed themselves and cause pain for the patient. We can use it in cysticercosis situations as well. Just depends on the patient. It's also recommended when the infection has spread to various other areas of the body. So, for example, Toxoplasma species can spread from mother to baby. So some methodologies that we can utilize include latex agglutination, ELISA testing, which you should have talked about in immunology. We can utilize indirect immunofluorescence assays, especially for staining for cryptosporidium. And nowadays we can utilize PCR, such as in the BioFire film array. So lastly, how do we prevent parasite infections? Different measures can include avoiding direct exposure to these parasites, keeping up on your personal hygiene, proper sanitation. So a lot of the times, especially for intestinal protozoans, we want to make sure that we are disposing of human excreta in their proper manners. Also making sure we've got adequate water treatment, so chlorination can also help. But the prevention of human parasitic infections is going to be directly linked to understanding the life cycles of the various organisms and their modes of infection. If we're talking about some blood parasites, there are chemoprophylactic agents, especially for malaria. So if you are planning on traveling to an area that is endemic for malaria, a lot of the times they will give you these prophylactic agents so that you do not contract malaria. Making sure that we're controlling various vectors, so controlling mosquitoes, controlling ticks, so we're not transmitting it from these vectors to the blood. And then lastly, adequate cooking of meats and various food types. We can also make sure that we are eliminating any fecal-oral contact by practicing safe sexual activities.